Greetings, everyone. Thank you for joining us for the January National Farm to School Network Farm to Early Care and Education webinar. Today, we're going to be looking at the Good Food, Great Kids project. And this is a collaborative project led by PFC Social Impact Advisors in partnership with the National Farm to School Network and the BUILD Initiative, aimed at developing a series of case studies on the emerging benefits of farm to early care and education. These case studies, along with the accompanying policy report, explore the policy and practice of how communities are joining forces to bring farm to ECE programs to vulnerable children and families. And we look forward to hearing from PFC Social Impact Advisors as well as Norris Square Community Alliance about how Farm to Sea is supporting equity and inclusion in the early care and education settings. So before we begin, just a few housekeeping reminders for you. This webinar will be recorded and archived for future viewing on the National Farm to School Network resource database. You will also receive a link to access this recording in a follow-up email. And in that email, you'll also have links to the resources and reports shared by our speakers today. So we're looking forward to increasing the viewership, and feel free to share this link and those resources through your networks as well. All attendees are currently in listen-only mode. We do anticipate a good turnout for the webinar, so we want to avoid any background noise. If you do have questions, and we hope you do have questions for our wonderful presenters, please feel free to enter those into the question box on your control panel. Feel free to enter those at any time, and we'll be addressing those following each presentation. And we will have plenty of time for those questions and answers, so please feel free to chime in whenever you have a question. So without further ado, let's go ahead and move into our presentation. This is Lacey Stevens, and I'm the Farm to Early Care and Education Associate for the National Farm to School Network. Please, if you have any questions about the National Farm to School Network, Farm to Early Care and Education, or this webinar, please feel free to reach out following the webinar. So today, in addition to hearing about the Good Food, Great Kids project, I'll be sharing a little preview of what the National Farm to School Network has in store coming up in 2017. Following that, I'll give a little background on farm to early care and education for those of you who may be joining us for the first time. I'll tell you a little bit about the basics and benefits of what farm to early care and education is. And then we'll jump into the real content of our presentation today. And we'll hear from John Sherman of PFC Social Impact Advisors about the Good Food, Great Kids project and the findings from those case studies and policy reports. And then we'll hear from Yoshiko Yamasaki and Nilda Pimentel from Norris Square Community Alliance, who are highlighted in the Good Food, Great Kids case study. So let's start with a little bit of background about what the National Farm to School Network is looking towards in 2017. So many of you who are connected with our organization may have seen our request for applications for core partners that was released at the end of 2016. So we're really excited to start this new year with a little bit of update to our organizational structure, and we are seeking out core partners in each state, Washington, D.C., and U.S. territory, who, along with supporting partners, will spearhead and coordinate the farm to school and ECE movements in their respective locales. We are really excited to embark on this modified structure, which will no longer include regional leads, but really refocus our attention on developing and strengthening the support of state-level initiatives, and that we see as a great opportunity to further institutionalize farm to school and farm to early care and education. So if you're interested in learning more, you can find more details of the RFA at this address. Applications are due Thursday, January 26th. And if you have any additional questions on this, you can email rfa@farmtoschool.org with specific questions or requests for more information. Another exciting project National Farm to School Network has on the horizon for 2017 is a continuation of our commitment to partner with Native communities across the United States. We are currently in the process of hiring a program associate to help support this work with Native communities, and we'll keep you all updated as we move forward with these projects. 2017 also continues our emphasis on expanding and institutionalized farm to early care and education. So with our new core partner structure, we'll be really re-emphasizing and looking at opportunities to continue to support state-level networks and our core partners in each state to help them expand farm to early care and education at the state and local levels. We'll continue with our quarterly webinars, this being the first of 2017, with 3 more this year to come. And we'll also continue to maintain our farm to early care and education listserv. So if you're not on that listserv yet, please email and I'd be happy to include you. It's a way for farm to early care and education stakeholders to maintain connectivity, find out what the new resources are, what new activities, events, opportunities are happening in the farm to early care and education world. So if you're not a part of that, please let me know and I'd be happy to add you. We also have some new and revised resources that we anticipate releasing in 2017, including some resources around how to connect with early care and education programs and building state-level networks. So we look forward to sharing those as they're available. So now let's start to think about moving into the content of our webinar. We're thrilled to have PFC and NSCA here to talk about the Good Food, Great Kids project. So following the webinar today, we expect participants to be able to understand the purpose of the Good Food, Great Kids project and how these project resources and reports can be utilized in your own work. We also anticipate participants to better understand the benefits, challenges, and opportunities inherent in farm to early care and education and the lessons gleaned from these case studies that we'll hear more about. And with the Norris Square Community Alliance, we hope that their presentation will allow all of you to utilize the lessons that they've learned, including forming cross-sectoral partnership, engaging parents and families, and developing farm to EC initiatives that really promote social equity. So today we'll be hearing from 3 presenters. First, we'll hear from John Sherman of PFC Social Impact Advisors. John is the Senior Managing Director. He has a Master's in Public Health from the University of Michigan and brings 35 years of experience in nonprofit advocacy and management, grant making, and strategic planning. He's also led the Cluster Evaluation for and provided strategic advice to the W.K. Kellogg Foundation's community-based food system work for the past 18 years, including farm to school and farm to early childhood education. As a thought leader in policy evaluation, John completed evaluations of advocacy efforts in the Federal Farm Bill and Children's Health Insurance. Next, we'll hear from Yoshiko Yamasaki of Norris Square Community Alliance. Yoshiko left her practice in Mexico as a dentist and moved into health promotion activities when she settled in Philadelphia. At Norris Square Community Alliance, she has provided overall leadership and oversight for designing, implementing, and monitoring health, nutrition, and safety services for the 7 Head Start and Early Head Start centers, including food service programs. Yoshiko convenes the Health Services Advisory Committee for Norris Square Community Alliance. She's a member of Temple School of Public Health Community Advisory Board and a partner at North Philadelphia Health Improvement Committee. Along with Yoshiko, we'll hear from Nilda Pimentel. Nilda serves as a consultant to Norris Square Community Alliance's Head Start program. In this capacity, she's responsible for securing and managing strategic partnerships with community and private institutions and seeking resources and funding for special projects, including Norris Square's Farm to School, Farm to ECE initiative. Nilda has spearheaded advocacy campaigns and developed special initiatives in the areas of public education, community development, and after-school programming to advance social and economic justice for underserved communities. So we're thrilled to have these wonderful speakers with us today. So as I mentioned, to start us out, ensure we're all on the same page in case you haven't joined one of our webinars before, I'm going to briefly address some of the benefits and basics of farm to early care and education. So farm to early care and education is this broad group of strategies and activities that offer increased access to healthy local foods, gardening opportunities, and food-based activities. So we really don't see one farm to early care and education program. We see a diverse set of activities that are really based on the needs and capacities and desires of each individual program. But they do all collectively target children ages 0 to 5 and are adaptable to all kinds of ECE settings. So we're really thinking about Head Starts, family child care programs, early Head Starts, child care centers, preschools, all types of places that we can reach children ages 0 to 5 and their families. So as I mentioned, every farm to early care and education initiative looks a little bit different, but most or all of them include one or more of what we call the core elements of farm to school. And all of these elements really work together for maximum benefit. So we have the educational piece in the classroom where children have the opportunity to learn about where their food comes from and taste test it and talk to farmers. All of these many different opportunities for educational experiences around food and agriculture. We have the procurement side, so bringing that farm fresh food and products into the classroom or the early care and education setting for meals and snacks and taste test opportunities. And then that experiential gardening component that really resonates with our early care and education providers and students. So as I mentioned, all of these pieces really work together. But certainly providers and programs can start with any one. Gardening is a really great way to get started. But once we start gardening, it's also a great opportunity for children to have those experiential education opportunities, learning about where that spinach that you might be growing comes from, giving it a taste test, cooking it in the classroom, and learning about the different parts of that spinach plant. Once that child sees the spinach growing in the garden, they're going to be much more likely to eat the locally purchased spinach at snack or lunchtime. So it's important to note these educational gardening pieces can be a big contributor to the success of the procurement process as well. So why do we find farm to early care and education to be so vital? When we talk about farm to school for any age group, we really see it as this triple win. From the little ones up to college age, we have kids experiencing these wins, having lifelong healthier habits, improved academic performance, engagement in the classroom, and really understanding and connecting with their food. Certainly farmers are winning with increased and diversified market opportunities and increased income. And communities are winning with an increase in local economic activity and impacts on household food security. And when we talk about our farm to early care and education specifically, we have a lot of additional benefits that really align with the goals of the early care and education community. So we have the opportunity for really enhanced family and community engagement. Numerous opportunities associated with farm to early care and education create meaningful activities and engagement for the whole family and influence food choices and food access at home as well as in the early care and education setting. Many of our farm to early care and education activities provide this enhanced educational experience as well. We know these little ones learn best through sensory experiences and utilize all of their senses to learn about their world and develop appropriately cognitively, physically, socially, emotionally. So we have a lot of learning opportunities associated with farm to early care and education that contribute to this success. And then, of course, health and wellness. We know that these new food experiences, children are developing taste preferences that are vital to influence in these early years of life. And the opportunities to connect with food can encourage children to try new foods and continue those healthy habits for a lifetime. And we also see an opportunity and a commitment to social equity through farm to early care and education, ensuring that all children and families have access to high quality food and high quality educational opportunities. So we really look to this opportunity to show providers and show stakeholders how farm to early care and education can align with the goals of the early care and education community while having all of these fantastic additional benefits for families, farmers, and communities. So with that background, I would love to start moving into the content with Good Food, Great Kids project, and I will turn the mouse over to John now. John?
Great. Thank you, Lacey. And welcome, everybody. I'm really happy that all of you have joined us, and I'm really pleased to be sharing the time with the folks up at Norris Square who have a really great program to share with you. What I want to share with you is give you a pretty big, just a big picture overview of our work with Good Food, Great Kids in our collaborative with both the National Farm to School Network and BUILD, as Lacey has already mentioned. The work has been underwritten by W.K. Kellogg Foundation. As Lacey had mentioned, Kellogg has been one of the foremost supporters of access to good, healthy food in low-income communities, both in the communities itself as well as in schools, and in the last couple of years really focusing also on the early childhood environment. And we're pleased to also be supported by them. So the focus of the work. Lacey, I don't think I have a control. Thank you. So what I want to talk about today is just what I said, the good food work. What we've learned from the case studies, what we call the recipe for success, and both in terms of the case studies and some policy we'll review, and also talk about the next steps. Before we go into that, I wanted to talk a little bit just about PFC and what we do. And the big picture is that we're involved in kind of looking at the major big socially complex problems of the world, what we call the WICA problems, the ones that, as the World Economic Forum talks about, keeps business leaders, government agencies, nonprofit leaders up at night, whether it's migration, poverty, climate change, lack of clean water, food shortages. All these are significant problems, and we work to engage philanthropists and the business sector in helping to tackle them. While we think about that, we often put women and children in the middle of all of our work, and the impact of those wicked problems particularly focus on them, whether you're a child in New York City, in Iowa, or in Bangladesh, that, as you can see from these numbers, women and children are often the ones that get the brunt of our problems. And just take a look at these few slides that you'll be seeing now about just kids, and think about the real problems, as Lacey has mentioned. 16 million of them are hungry in the United States. 1 in 5 of them are obese. 13 million have food insecurity, and they're worldwide as well as the United States. Of course, kids are the most visible victims of what happens when they don't get enough nutrition. What all this means is that for those of us who have the honor of being able to do this work, that we look at as saying, one, we have this privilege, and we need to do, as Audre Lorde says, be deliberate about how we work with it, and don't be afraid of taking on the hard issues. NFSN has done that, and this work falls right in that landscape. So with that, let me turn now to why are we thinking about good food, and good food is important. Lacey's already touched on a lot of these, so I'm not going to dwell on it too long, other than saying, of course, that the numbers are sobering about why we need to work with kids in general, but also knowing that we know that 60% of all the children in the United States under the age of 6 spend some time in child care every year, and that those kids who go to those child care centers receive up to 70% of their daily nutritional intake from the food at those centers. So it's a big deal about what they put in their mouths, just from a nutrition standpoint. And of course, Lacey already talked about the other issues in terms of why you get parents involved, why you can broaden up and involve the entire culture of the community in this work, not just starting when they go to kindergarten, but starting when they actually are accessing the child care system at a much earlier age. So I want to step back and or step into the specifics here. And what we looked at were 6 different successful farm to early child care and education sites. 5 of those I'll be talking about. The 6th one, Norris Square, will be talking for themselves. We also looked at some policies at the state and the national level that can be helping or hindering the work. And before I go any further, I just want to make sure that there are 3 people recognized for the work they've done in this. One is Hilda Vega, who is actually the lead for this work. And Hilda, if she were here, would be doing a lovely job of presenting this instead of me. She has taken time off to take care of her ailing parents. The other 2, Mark Lunenberg and Rebecca Drobus, all the photographs you see on here are by them, and we deeply appreciate their creativity and the willingness of all the sites to allow the kids to have their photos taken. So with that, the big picture, and again, Lacey mentioned this a little bit, but the big picture I want to make sure that you take away from the work is, regardless of where, any site we looked at, there are particular pieces that came to bear. One is that there was, while it takes a community, there's always, as probably you know in much of your own work, that there's somebody who has a particular passion a particular vision and who has a big heart and is a small ego that allows the kinds of sharing and collaboration that's necessary to make it happen. Secondly, the idea that one organization can't do it alone. You need both the expertise, the knowledge, the experience of folks who are actually on the ground doing the work, like many of you may be doing with early childhood care centers. You need the experience of the farmers and the folks who are actually in the food system to help understand how you aggregate and get actually healthy food to you. And third, you need the folks who are actually on the ground in terms of understanding policies and systems that both impact and can contribute to making sure that everybody's engaged in the work and can be successful. So if I miss any of those points as I'm talking about these particular case studies, just call me on it, and I can turn back to it. With that, let me just turn quickly to the 5 of the 6 sites I'll be talking about. The first one is up in Minnesota, where there were as we talk about the ingredients, the 3 partners who were involved in this. One, the Institute for Ag and Trade Policy group, was the group that brought that food policy and the deep knowledge of food system work to the table. The Hmong Farmers Association, they were the ones who actually were the farmers, who understood food production, food aggregation, and how you get it to move it from the farm to the plate. And the third one was the Head Start group there, the Community Action Partnership. So the important thing to think about with this one was just probably the most important takeaway was these are 3 organizations that had never worked together. So regardless of whether or not they look alike, think alike, talk alike, they'd never worked together. On top of that, these organizations had very different cultures. One was the Institute for Ag and Trade Policy, a predominantly white organization with lots of kind of buttoned-up policy, work, a lot of experience on the ground as well, but with a particular way of thinking and doing. You contrast that with the Hmong farmers who were Hmong and who were on the ground doing the farming, and then the Head Start group, which hadn't known of either of these groups before, and they were a servants agency. So bringing these three together, probably the most important, I think, lesson that we noticed out of that. By the way, I love that picture. That's my favorite picture. The thing we learned from that, and they reflected to us, was that you have to, and of course this can be applied to any situation, but you have to be incredibly deliberate about wanting to work together, making sure that you communicate clearly on the front end of what expectations are, and do a lot of listening. So there was a whole process about making sure just that culturally they were aligned. Secondly, the really important lesson was moving out of that process piece just to the mechanics, that there's the pragmatic issues of how do you actually make sure you're moving the food from the farm to the Head Start Center in a way that the Head Start Center can accept and can actually use it. And when you're having problems, how do you creatively work with one to solve them? And it was, I think, the smiles on the faces when you hear, especially the Hmong farmers Farmer Association talk about how the willingness for everybody to put their shoulder, work together to figure that out, was really important. And the idea was, and what came through really clearly in the work, was that child was in the center of the work. And so what they needed to do to make sure that child got what he or she needed was the most important part, more important than whatever particular organizational issues or organizational roadblocks they were running into. And the third part that we really learned from that, which Lacey's already mentioned, was that this idea that you need to move beyond, when you're thinking about the work, it's not just about what's happening with the child in the school, but it's happening about what's happening with a child in the family and what's happening with the family in the larger community in which they work. And they, the group in Minnesota worked really hard to make sure that those pieces were in place, and not all at once. But they were taking steps to continue to expand, and I think beyond just what's happening in the building. Moving south to about 3 hours south of Minnesota, it's a very different situation where you're in northeast Iowa, 6 counties, rural, mostly white, but similar in terms of their economic income and challenges that they have in terms of kind of what their own demographics and in terms of economics was. The important thing to remember about this group, and a couple others I'll be talking about, is that there was a long history with Northeast Iowa Food and Fitness, one of the 3 ingredients in this mix, that they had worked for over a decade in helping build a really robust farm-to-school system and community-based food system that to think differently about where food came from and where food went in their communities. And that history set them up well, and I'll reflect on this in a couple other communities as well. Not that it's always the case, but it's with these communities there was a lot of momentum before the farm to ECE came into being. And we've worked with Northeast Iowa for a long time and know that group well. These other, and as well as Luther College, another ingredient. The third one, the Northeast Iowa Community Action Corporation, was the Head Start group. So that obviously, having without that you don't have anything, right? So that was they were an important part of it. The takeaway and kind of some of the highlights for keys for success there were a little bit different than up in Minnesota, but because they already had a lot of work already happening in the community, they didn't have somebody actually that was really their focus was on the ECEs, and so they hired somebody. They actually invested in that. They had an intention to make sure that they focused on those in a way that wasn't just I do it at the end of the day, but it's their full-time job. Secondly is to look to where you can leverage, and they did this well, what they already knew and the infrastructures, both in terms of the relationship infrastructure as well as the infrastructure of actually moving food from the farm to to a school or to an early childhood center were in place. So they just wanted to make sure that, and they did that well, they leveraged what they had. Of course, they adapted their work to the younger kids. And the other important part was that they early on engaged the teachers to get them to make sure that they were sufficient role models for the work of the kids, for how the kids are eating. In other words, not bringing a McDonald's wrap bag into school with them, as a simple one. So from rural Iowa, we moved to New York, and the work with Bedford Stuyvesant Restoration Corporation and its partnerships, both with the Corbin Hill Food Project, which is a food hub, and my apologies for not spelling out the third partner fully, but this was the Bedford Stuyvesant Early Childhood Development Center, basically the Head Start program in that area. That in there, the context was different, obviously different from Iowa, but also from Minnesota in the sense that they were faced, if any of you know Brooklyn, it's the wealthy people from Manhattan are moving to Brooklyn, so they were being squeezed. They were already low-income people being squeezed by high property values. At the same time, had significant diabetes and obesity problems. Food insecurity was high, meaning that kids and families didn't have enough to eat, and they didn't have access to even buy healthy food. There were a few grocery stores. The Bed-Stuy Restoration Corporation, a community development corporation, was focused on doing all sorts of economic development for this low-income community. It saw also as its role to make sure that part of the economic development was to make sure there was healthy development of their kids, and that's the reason why they got involved in thinking differently about bringing it bringing healthy food to the table. And in this case, what was interesting, this was a development corporation, very different than what you saw in Minnesota, a very different partnership than what you saw in Iowa. And I know I'm running a little bit short on time, so I'm going to speed up my conversation a bit. But the big thing that they pulled out of their work was that the observations that some of you may have had is that one, what they learned, and they didn't think that when they went into it, they didn't think this, was one, the early childhood centers that they worked with were very interested in healthy food options. They were concerned that they had no interest in it because of the second issue, that it was going to be too expensive. And probably National Farm to School Network, as well as anybody, can talk about how it doesn't have to be expensive if you pretty much put your recipes right, as well as making sure you take advantage of the federal and state support systems that are there to help reduce the cost, especially for low-income kids. And the third one was that it's not always these early childhood care centers are not isolated from the food system, are not isolated from the bigger community, one, and two, preparing food doesn't always have to be as labor intensive as one thought. Not that it doesn't take more, but it's just not as much. Let's, moving from New York, we're going to head south down to Washington, D.C., where there was a very different situation than the ones I've talked about before in one important sense. In Iowa and in Minnesota and in New York, all those places had been invested for a long time in developing the food, a kind of a community-based food system, and had been committed to that and been nurtured by others to do so, including the Kellogg Foundation. With the work in D.C. was different. This was a much more of a homegrown piece that that blossomed, so to speak, from its own passion, without having the kind of history that some of these other ones did. And so as we call the ingredients, the Centro Nia was the actual the Head Start Center, the early childhood care center in D.C. City Blossoms was a school garden group. It along with the local farmers and farmers markets were the food sources, as well as, of course, the City Blossoms being that one of the three pieces that Lacey talked about, important to any farm to school system, being a school garden. And the fourth partner was a District of Columbia itself, in helping to just think through what the policies were and how they could accommodate what CentroNia was trying to do. This one had a very strong cultural basis coming out of CentroNia, and the founder of it, Bibi Otero, where she saw that the need for, her own belief was that, as you can see in this Life Gets Nourished in the Kitchen, that food is a really important part of what they're all about in terms of servicing kids, not just taking care of them, but actually helping them thrive. And secondly, that a really important thing that she did was, when they built a new building, was we don't want any more food vendors just bringing us food that isn't very healthy, even though it might be totally legitimate with the federal regulations. We don't think it's good enough, and that she demanded, and they built an on-site kitchen so they could prepare their own food. So passion, an on-site kitchen, and a government that was helping them work this out. In a city and in a place where poverty was really high and violent crime was really high, they had she saw this as a place to make a difference. Some of the takeaways from the DC site was, in a way, not that much different from some of the other sites, although a real hallmark of the Centro Nia was that don't try doing it all at once. Go slow. Listen to what the community wants, what the family wants, what the parents want. Not wavering from your own commitment to what you think is right. But she was, you hear them talk about it, and you hear Bibi Otero talk about it, and it's just what you see here as you need to start and be consistent, but don't think you're going to make, or don't try to make all the big changes at once. Secondly, focus on parents. Again, Lacey has referenced that. Third, they had this very they have this really dynamic on-site garden called City Blossoms that has perhaps been the most effective in terms of being able to integrate the kids' experience in the garden with what the kids are learning and engaging in the classroom itself, not just whatever the curriculum may be, but also, as you can see, they sang, they danced about it, they took stories home, they took their experiences home. They even Centro Nia even expanded to think about how do we start thinking about bringing fresh food to the homes through these, into home care centers, not only as a way to make sure that you're kind of putting out the idea around healthier food, but it was also an income generator. So it was a twofer on that one. Moving to another place. Now we leave the East Coast and we go back to the Midwest. This time it's not as rural. It's in Kansas City, Missouri, where and in this one, the Good Nature Family Farm was the provider of, was the source of the food. The Treat America Bistro Kids was actually a food, a food catering service to Head Start and to early childhood programs. Plaza del Nino was the Head Start program which they were working with, as well as we had Kansas City YMCA, which of course has early childhood care centers, and kind of a university as the academic evaluator for the work. Important here is that Good Nature Family Farm in this group has been involved with local food work now for well over a decade, probably about 15 or 20 years, and so they bring both a lot of experience to it, but Good Nature Family Farm also brings an incredible amount of passion to the food part of it and a desire to engage with low-income communities and work with them. So in this case, when you're looking around for examples, this is an idea of a strong farm connection. They're as good as they get in terms of their commitment, both back to their farmers and to their consumers. The Bistro Kids was an interesting one because different from the other places, this was a food service organization that had, the owner had an epiphany several years ago about we need to change the way we present food after seeing what the kind of food her child is being served in the schools. And so she, this was one of those fortunate cases where there was the Bistro Kids, there was a farm situation, and there were both a couple of really great early childhood care centers that wanted to do the work, that wanted to bring healthy food to their kids. So different than the other ones, this had a food catering service, a food service in the middle of it, which for them was the right thing. And as Lacey said, one size doesn't fit all, but it fit well in Kansas City. So I'm going to leave the case studies, and the sixth one, if you're counting, is the one that Neela and Yoshiko are going to talk about in a minute. So I won't go there with my conversation. But turning to the policy piece, for those of you who are involved, this should be no surprise, but there are policy opportunities at the state and the national level. Federally, there's the U.S. Farm Bill, which goes by different names depending on who reauthorizes it. There's a Child Nutrition Act. There's a Child Care Development Block Grants, and there's Every Student Succeeds Act. It's some of the most important, important hooks for you to think about and take advantage of. And National Farm to School Network knows these policies as well as anybody, and that if you want to dig into the details, they're the place to turn. State level, it's really interesting because, of course, they're the ones that get the child care development block grants, and so there's a way to shape them there, and to both define what kind of health practices are acceptable at early childhood care centers is using and taking advantage of the QRIS, which as you may know, the Quality Rating and Improvement Systems piece. It's a volunteer piece that more and more states are using to help shape performance standards at early childhood centers, including standards around healthy food. And there's a whole separate effort underway right now to learn more about that. Kellogg is funding a pilot in 4 different states. Norris Square is involved in that as well. And Neela or Yoshiko, you might be able to speak to that a little bit more. With all these, though, a piece that we don't know is, given the incoming administration, what any of those policies are going to mean. While there are while there's language in the law itself, the agencies, the U.S. Department of Agriculture in particular, they're the ones responsible for implementing it. And depending on who's at the head of that, and how much money they're going to get is unknown at this time. And I think being able to crystal ball that, I leave that to you. One of the just kind of big picture lessons and levers that we looked at beyond the kind of the summary I just mentioned was that there's different places you can look to learn more. One, as I talked about, the Learning Policy Institute has done an analysis for the state of the 4 states that are trying to apply this farm to ECE work, and I would suggest you look at their information. It's more than I can cover right now. The ideas, though, around how do you get policies that can help prioritize and improve kind of this continuous improvement. QRIS is one of those places where that kind of thinking around creating best practices and enforcing best practices is being done. In some places, the policies are actually helping shape and provide money for how do you train and coach teachers, whether it's current teachers or it's teachers to be through university settings or elsewhere. North Carolina has a really interesting program for that. And then looking at how you do a better job of integrating through policy, the different programs that serve these kids, and whether it's whether it's the programs at ECE itself, or whether it's the Women and Infant Child Care program, how do you start thinking about those policies and the implementation that was being better coordinated than sometimes they are to date. The idea around another important policy piece is how do you what we're looking for and trying to a lesson is how do you combine the funding sources from multiple that are generated through different policies to be able to improve access and improve quality. And sometimes those are at odds with one another, and or at least don't align well, if not actually at odds. And so that makes it harder. And so there's an opportunity there to how do you improve alignment. I'm not going to dwell on this slide too much, other than to say that when we started looking at particular states, Minnesota had a particularly strong kind of from nuts to bolts about what was going on in terms of the model, from how the state thinks about supporting farm to school, how many school districts are really engaged with farm to school, the support from the governors and the politicians and Department of Health, not just for the farm to school, but now moving into the early childhood and education. So when you look in your states, looking at not just what's happening into farm to ECE, but also looking at what's happening to farm to school, and actually what is it looking like in terms of the state supporting community-based food systems. That gives you an idea of what the culture is like in that state to be supportive of local food systems and the various markets for it, including early childhood. And then we also just cataloged in the report several different really great state models. And Lacey, I know you're going to share the website and the data so they can receive all of you can download a report, but I would just encourage you to do so, because each of these states has some interesting insights that may help you think differently about your work and how you position your work in your state. And I think as this girl is giving her thumbs up, there's some thumbs up about how, what the major reflections are and next steps for the work. And when I look at this list, I think the important ones for you to take away, if you're not already doing this, is the idea around alignment, making sure that everybody is talking the same language. So when you do run into the barriers, which are inevitable, you'll have some common ground and some common language to figure out collectively how to deal with it. Partnerships. Look for partners that you might not otherwise work with. Kansas City is a perfect example where you're working with a food service provider that in other places, they rejected the food service provider, like in DC, because they were bringing you bad food. So other places that have allies that can smooth the way. This idea around research, there's always not enough research to satisfy some agencies and decision makers. There could be more research done about the connections to health and to economic development. And the final piece is just be advocates in your community. Advocate, learn how to get the information, educate parents and governors and mayors about what's happening and about the opportunities. You see in all those sites that kind of outreach to those to decision makers in the political arena and the business sector were important for their success as well. With that, I'll stop. I just want to again say thank you. And while this site will be shared with you, the website to download the report on policy, the report on the case studies, as well as what we have a little what we call our cookbook, or kind of the executive summary of the 6 sites you may enjoy as well. Thank you.
Thank you so much, John. It's so fantastic to see this diversity of programs, diversity of models, and especially thinking about this kind of diverse menu of policy opportunities to leverage. And as you mentioned, this is certainly an area that the National Farm to School Network takes a lot of interest in, with advocacy and policy being one of our major priorities. So we continue to look at how we can support policy at the federal level to support opportunities for farm to early care education, as well as supporting our state partners. So you've touched on some great kind of examples of how folks are leveraging, and we look forward to sharing that out. As John mentioned, we really encourage you to take a look at this full case study reports as well. But we do have some time for some questions. So if you do have questions for John, please feel free to put those in our question box. I have a question for you, John. You mentioned this. Each example really had a different combination of partners involved. And one thing you noted was how these different partners may have different kind of programmatic or organizational cultures, and the importance of kind of aligning those cultures. And I'm wondering, from what you've seen in your experience, what are steps to take to help align those cultures to increase communication in some of these unlikely partnerships?
So thank you for that, Lacey. And I'm thinking about Nilda and Yoshiko in Philadelphia, and hopefully you'll ask the same question of them. So I don't know all of you that are in the audience. I think that probably a lot of you know what I'm going to say already and had this experience, is that it's what we saw and what you see elsewhere is it's starting small and starting the one-to-one conversations with these different partners. And you start small and you start exploring, not going in with a full-blown agenda of how you're going to make sure that every early childhood center in your community has access to healthy food. It's the quiet listening, the kind of stuff that a good example was how Centro Nia did it in Washington, D.C., but elsewhere, where, and I'll tell you, the example in New York was a really good one, where they ran into a bunch of bumps early on about who the right partner was. Are they actually on the same page in terms of outreach? There were some folks, I think we can say, were kind of know-it-alls about how to do the work. And as you know, when you're building collaboration, building partnerships, know-it-alls don't work very well. And the common thing was listening. And you could probably say, if you look at the common thing in, I think, every one of them, I hesitate to say this, but they were all women. There may be a gender issue, but it was something that in every one of these cases it was women. So
great, thank you for the insight, and we'll allow our next presenters to address that question as well. Another question we have is around what examples have you seen in these stories for how programs have been able to bridge the gap between their potential food budgets and being able to a fair compensation price for a farmer's food, which we know can sometimes be more expensive in some situations, and as you mentioned, is a perceived barrier. So I'm wondering if you have any examples of how programs have been able to overcome that real or perceived barrier about expense for food and ensuring farmers do get a fair price.
You know, that I would say that is the toughest piece of how do you ensure fairness kind of all along the food chain, from whether you're the farmer or perhaps you're a farmer that employs farm workers, to the plate, and that plate can be in an early childhood care center, or it could be you know, at your dinner table in your home. And but with the early childhood care piece is mostly all the you look towards what are the federal subsidies you can get that can help reduce your you know, basically help subsidize that, you know, that cost. And that's a, you know, that's a really important one where you can get that kind of subsidy. You know, the Child and Adult Care Food Program is one where I assume many of you know about, and you know, that's an important, one of the important policy pieces within the Child Nutrition Act, currently called the Healthy and Hunger-Free Kids Act. But that's an important piece. But looking for those places where there are, one, there are subsidies, and two, and this may be some of your colleagues, Lacey, that really do this too, but speak to how do you create the right mix, the right menu. So where can you take advantage of things that might be more costly here, but maybe there's something else that's less costly. Something I know that, you know, we talk about the middle of the plate versus the, you know, the edge of the plate in terms of vegetables and fruits versus protein. Each of those you have to look at the mix, and I'm going to defer to National Farm to School and your colleagues about how to actually make that mix right in terms of costs.
I think that's a great point, John, and it really takes some kind of individualized support and education for providers about designing that menu in an appropriate way, and thinking about purchasing seasonally, and understanding what's available at a reasonable cost within your region and your locale, and looking at examples of how to balance that meal planning and budget. So I would definitely recommend folks take a look at our resource database for meal information, and I can also mention that the Chef Ann Foundation, the Lunchbox, will soon be releasing a set of example farm-to-school, farm-to-ECE menus, and a set of recipes that will really also highlight the opportunity to balance those costs and meeting new CACFP guidelines with local foods. So stay tuned, and as I mentioned, please connect on that listserv if you aren't connected there yet, and we can continue to share out resources around that. And I think that also brings up a good point about how farm to early care education is not in that bubble, as you mentioned, John, and we have to think about how we can continue to enhance full food systems and full community food systems to ensure that balance. So certainly another area of partnership as we look at other partners and food systems partners. So I think we have time for just a couple of more questions, then we'll move on to our next presenters and then open up for a little bit more discussion following our second set of presenters. So we do have a question thinking about how any insights on how to deal with the idea of having competitive non-for-profits where you're competing for a finite amount of funding versus the idea of kind of raising all boats in the system and benefiting everyone. John, do you have any comments on that issue?
Well, so in the systems where we looked at, in those particular case studies, that didn't come up as a major issue, but we all know it comes up. It's a common, you know, there's a competition issue with lots of nonprofits around whatever the issue may be, and I wish I had a simple answer for it. The idea of how do you figure out what your niche is in the work, one, and some of it is the conversation with how are you building the strongest partnerships, not just with, you know, the other providers. Meaning, if it's a nonprofit, let's say like Bed-Stuy Corporation that is thinking about economic development, how do you partner not with another economic developer, but with one who's actually doing the food work, like Corbin Hill was, or of course, kind of in the middle of it all is the Early Childhood Care Center themselves. But it's how are you, who, in a sense, there's some competition about how do you actually build the best partnerships. Best meaning that you're truly aligned, that you have the common language, and you have you can actually figure out how to overcome those not just the process barriers of culture, but the mechanistic barriers, the operational barriers of just moving the food and cooking the food and preparing it, and then of course working with the families. So it's I don't know if you can overcome it other than by demonstrating you're a better collaborator than your competitor.
Great. Another complex issue to be thinking about as we think about these kind of multiple issues contributing to Farm to ECE success. So in the interest of time, thank you so much, John, for presenting. And we will open up for a little broader discussion. So please stay on the line, John, so you can join us for that at the end. But in the interest of time, I would like to go ahead and move on to our next presenters. So I am going to go ahead and turn the mouse over to Yoshiko of Norris Square Community Alliance, who will be telling us about what is the 6th highlighted case study in the Good Food, Great Kids project. Okay, Yoshiko, you should have control now. Let's see, but you might still be on mute. I don't think we can hear you yet. Yoshiko, we can't hear you yet. Do you have your microphone on mute possibly on your end? All right, looks like we might just be having a little technical difficulty. Okay. Yoshiko, can you send me a message in the chat box? Let me know that you can hear me, and we'll see if we can figure out kind of an alternate way for you to connect here. Okay, while we're figuring this out, why don't we go ahead and we can ask a few more questions of John, if he'd be willing to answer a few more questions while we're kind of getting our technical difficulties worked out. Is that Yoshiko on the line? Okay, let's see here. All right. All right. Ariel, would you mind working with Yoshiko and Nilda and see if you can work that out? And I'll ask John a few more questions while we're getting that coordinated. Okay. We have a question from Minnesota. An individual who is working in farm to child care, and she's finding that outreach to providers and parents has been an obstacle. So I'm wondering, John, if you have recommendations that you saw in these examples about ways to reach out to...
Can you hear me?
Yes, yes. Oh. There we go. Sorry for the interruption. We'll circle back to that question, but we do have our presenters on the line. So Yoshiko, I will turn over mouse control, and please feel free to go forward with your presentation. We're looking forward to it.
Hello, I apologize for this. It is very nice to be back with you. I was talking and I didn't know that nobody was listening to me, but I apologize for this glitch. Nilda will start with the first part of the presentation. Ben.
Yes, hello. Our apologies. It was muted sort of automatically, so we're trying to figure that out in the other computer. Good afternoon to everyone. Can everybody hear me? Hello? No?
Yep, we can hear you.
Okay, very well. Well, we really thank the conveners, the National Farm to School Network, for the opportunity to sort of present and be part of this community of knowledge. As newcomers in the field of farm to school, we're really approaching our participation more as learners or apprentices rather than experts, since our initiative began 8 months ago, and we're still in the middle of planning. So I think that the best way to start.
We don't have control over the mouse.
Oh.
That's lazy.
Lazy, we don't have control of the mouth.
No, we don't.
Okay. I think that the best way to start is by giving you some background about Norris Square, its history, the services they provide, but I'm not going to sort of go over every single point. I'll just summarize the frames listing the information. As it has been the case with many nonprofits over the years, Norris Square has sort of evolved from a volunteer-driven association to a comprehensive community development corporation, focused on improving the built environment and building and managing low and moderate income housing, and also expanding home ownership opportunities for local residents. And throughout the years, it has sort of branched out to provide youth and family services. Currently, it operates an after-school program or after-school programs at 3 different sites in public schools, and it also works with at-risk teens and their families. And it was not until 5 years ago that it began to provide Head Start and Early Head Start, currently serving over 900 children. As in many urban cities, I would say that poverty is Philadelphia's most daunting and intractable problem. The city's poverty rate stood at 28%, although it was down slightly in the past few years, but it's still among the highest among the nation's 10 largest cities. In terms of Norris Square service area, we are part of Pennsylvania's 1st Congressional District, where more than half of children living under 18 live in households with incomes below the poverty level. In terms of the last point, in terms of the neighborhood being categorized as a food desert, the closest supermarket in this area is 1.5 miles away, and a third of the residents, those with very low incomes, do not have a vehicle. In terms of the population that we serve in the Head Start program, as you may know by the data, too many of our families struggle to make ends meet and face difficult choices between sort of paying a utility bill and putting food on the table. And the average annual income for a family of 3 serviced by our program is under $12,000, in contrast to the median household income in the service area, which is around $22,000. As listed in a previous frame, the Norris Square service area is categorized as a food desert and ranks 3rd citywide among the neighborhoods with the worst health indicators. and also the highest consumption rates of sugary drinks. According to some health assessments that were conducted over 2 years ago at Norris Square Head Start, it revealed that at least 32% of the children enrolled were considered overweight, although that has been reduced considerably since last year, and it will be measured again after our pilot Farm to School is implemented. So now what I'm going to do is turn the mic to Yoshiko, and she's going to be reviewing the next frames.
Hello. I apologize because part of the technical glitches that we thought we had survived, we haven't. Are you able to listen to me? Hello?
Yep, we can hear you.
Okay, thank you. Okay, I will just start going through, you know, how Norris Square started with these little changes, and we have been working with very closely with Temple University, with Drexel, with Jefferson. We are part of North Philadelphia Health Improvement Committee, and little by little we have been working on like little workshops, having workshops with parents. We started having because we really wanted to know how was the health literacy, how is that they were able to understand if we were giving a pamphlet or we were talking about nutrition, how is that parents and you know, the community would really relate and understand. We started working very closely with Alison Hayes, which works with critical nutrition. At these workshops, it was mainly with parents, and we had no idea that our own staff, there were staff members that they hadn't had, you know, a vegetable ever in their lives. So for us, this was like shocking. We cannot assume that a fruit or a vegetable comes, you know, just like a regular normal thing in our lives, because for some people it doesn't happen. This neighborhood, as Nilda was mentioning, it's one of the poorest, and the realities are very far from what we can relate to, and that is something that we learned from you know, working with Alison. We started then decided that we needed to start with staff, and we even brought chefs to introduce new foods. So we've had tastings, food tastings, and all these little things throughout 4 years, pretty much, of working with community-based research. So if you see on this first slide, it's pretty much a little summary of the things that we have been working in Norris Square towards a better and healthier way of life. So, for example, the menus, we started incorporating grains. We got rid of the fried foods. We used to give juice, 100% juice, which is acceptable by the CACFP. But in reality, the portion for a day is a cup. So if we think about it, our children pretty much have sugary drinks at home. So why would we add, even if it's 100% fruit juice, it's still pure sugar. So we decided to go only milk and water. These little changes are huge because and why they're huge? Because it is so important for children to have the habits formed when they are young, and if at home they are exposed to particular habits and traditions that the family has, so we need to expose them to better choices when they're under our care. I can go on and on. So let me just continue going through the slides. On our first part, you know, we started having trying to make accessible foods for there is a program here in the city and in collaborations with American Heart Association. And they go to the corner stores and they have like a little stand where they can access fruits. So people are getting more you know, have access to fruits. We need to make sure they are affordable, and Nilda graciously started a partnership with Common Market. Common Market brings local foods, and this partnership has been great because we've produced in kind as part of a discount that Common Market gives to us. We have visited Common Market, and we have brought the chefs and staff, and they have learned about these local farmers, what they grow. And I mean, it is so exciting to see one of our own cooks that she said, I don't like yogurt. I've never liked it. When she tried this yogurt from a local provider, she liked yogurt, and now it's something that she integrated to her diet. And for example, at one of the centers, when we started, okay, we're going to start cooking lentils. They didn't know what lentils. They had never tried lentils. So this has been a learning experience for staff and for everybody. Nilda will start talking about the goals of the initiative.
Yes. The timing of our initiative response to the alarming health indicators in our service area, and also from the findings that we gathered from the needs assessments that were conducted over 2.5 years ago, which found that very low levels of health literacy among parents, and also parents identified the best delivery tools to promote healthy eating, culturally appropriate delivery tools. So our project is no different from your typical farm-to-school model. It is grounded in evidence of what works, a program that incorporates the regular elements, the features that characterize farm-to-school programs nationwide. But in terms of our long-term goal, it's not just about, at least during the first years, to incorporate gardening, nutrition, food access in the model, but also to turn our Head Start centers into platforms for promoting healthy lifestyles in a creative and fun way, and within a multicultural framework. We also want you to bear in mind that we're into phase 1, which is the first year of our initiative. And while we are engaging stakeholders, those stakeholders went through a process which was facilitated by the Food Trust of reviewing promising practices nationwide, culturally appropriate curriculums. We are also delivering some programming introducing children and parents to basic concepts of gardening, nutrition, experiential learning activities, and also training parents not only on nutrition, but also on leadership development. We really see parents as partners, not exclusively as consumers. And what we want to really do is to motivate and assist parents to move beyond awareness and caring to hands-on advocacy. So through the targeted outreach and the comprehensive training, parents and caretakers hopefully will become more motivated to promote wellness in their respective centers and also program-wide, because we operate 7 Head Starts and early Head Starts, 5 Head Starts and 2 early Head Starts, and to utilize them as health promoters. The end goal of this parent engagement component is to empower them to really make positive contributions to the health of their children. Not only their children, but all of the children enrolled in the Head Start. What I will do now is turn the mic to Yoshiko, and she'll summarize some of the activities or highlight some of the activities that we have sponsored in the past 6 months.
During this process of the first year, we've had technical assistance from the Food Trust. This is to they assisted us in forming the stakeholders committee meeting, which it is a group of staff, community members, and parents, and working together to choose one of the really to learn about the needs, what they want, how they want it, and also to be able to choose the curricula that we will adopt for. So in this process, we adopted we chose City Blossoms, my first harvest. We have community partners that have been working with us throughout a couple of years. So one of them is Penn State. A little along the way, we are going to start talking about the community partners a little more in specific. But we started a playground that we had as a donation by Kaboom and ABC, and through volunteers. And there is an area where we have a garden, and part of this is to really make it something that everybody participates, something that it's not only, oh, we have to go and do this. And that is the part that has been really challenging, the engagement, because I really think that we all need to own the whatever we're doing. We really need to feel it. We need to be excited for it to work. And so it is a long road. The part of integrating whatever we're doing across the board. So we've had gardening classes. It has been really exciting because at one of the classes, I saw how they were just so interested in planting. They ended up planting lettuce that day, and there was this little kid that when the teacher started sharing and giving them little tastes of the lettuce, she started eating the lettuce, so she ended up eating the whole thing. And the teacher was like, you know, you need to let it grow. You need to wait for the next week. It might be, you might be able to eat more. So this was great. If you can see the first slide, this is part of the garden, and the pictures that you're looking at are the children planting and having class and having this lesson in school, learning parts of the plant and tasting food. It has been so much fun to watch the kids, you know, tasting new foods. And this is, for example, these are pictures of the stakeholders meeting, discussing and learning about the curricula, and they were deciding what is it they were going to choose. This is very important because we have the parents, they really, when they participate and they start feeling empowered and they start having their own initiative, it is really incredible to see how they build up their skills, and you can see little changes happening. These are pictures of we've had a class every Friday, and they had a nutrition class, and then they had a physical activity. You can see this at the bottom, the exercise class. The top one is a cooking class. This was very exciting because they would be tasting new foods, and it was made like in a fun game way. They were given foods that they have never seen or tasted. So the idea was for them to learn through a recipe and cook it and taste it. On the left side, on the top, you have a picture of the food that every Friday they would be able to get and take home. Oops. I don't know why I'm going forward. And okay, so here is the instructor, and you know, going through the lesson. We have more pictures about the food access, and it is very rewarding to see how even they started asking for more vegetables and more fruits, and really learning, because the nutrition class, they will show them how to cook and use those ingredients that they were getting. Nilda will start talking a little about the community partners.
Yes, through our partnerships, we have generated over $50,000 worth in non-federal share in the form of pro bono services, discounts, and donations for the program year. It has been a great vehicle to generate a new stream of non-federal share and to tap much needed expertise to help shape many of the program offerings. For example, through our partnership with Common Market, which is a mission-driven food distribution organization that that distributes food products, fruits and vegetables, grains, and poultry from over 80 farms in Pennsylvania and southern New Jersey. For every $500 purchase in food products, we generate $125 worth of in-kind through a special discount program that they extended to us. So it has been very, very helpful. Not only we have achieved savings, but we have also been able to generate much needed in-kind or non-federal share, which is so important for the Head Start programs. The nutrition classes that we have provided to the parents have been offered through a partnership with Penn State University, the Co-op Extension Program. We have also engaged a local non-for-profit that specializes in urban gardening to provide the or deliver the content for the gardening classes. We're in the process of developing a partnership with Jefferson Hospital for the Center for Urban Health, for them to help design a nutrition health literacy course for parents that already graduated from the first round of nutrition classes that we have offered. We also develop a strategic relationship with Bed Bath & Beyond and Bye Bye Baby, the same company, for product donations. There is a partnership with Novik Brothers, which provides also much needed in-kind, and also they'll be providing or hosting trips to educational farms. We're also in the process of engaging another non-for-profit mission-driven organization that has an incredible reputation here in Philadelphia in terms of urban gardening. They will be engaged to participate in the professional development training, the teacher training that is going to take place at the end of this month. And we have also engaged Fuel Abundance, and that is in the process of being finalized, that relationship. We have been very strategic in terms of what type of relationships or the organizations that we have tapped for specific services to support and enhance the initiative. And as our program grows, we are also hoping to expand on the number of partners. In terms of phase 2, as I mentioned earlier, this is a 2-year sort of planning grant that is funding our initiative. The second year, which starts in April of this year, consists of scaling the initiative from 60 children at 2 pilot centers to 848 children at 5 Head Start centers. It also includes a more comprehensive training for parents that are already participated in the first level of nutrition classes, to train them as health promoters, and also to help or supplement the efforts that the family workers and the parent organizer that is part of the Farm to School initiative are conducting program-wide and at the center level. We also have to integrate, that is the long-term goal, but we hope to achieve that in the second year after the teachers are trained. The pilot is implemented, evaluated, scaled to incorporate nutrition as a core subject in the dual language curriculum that Norris Square has. We're also going to continue with professional development to effectively deliver the Farm to School content in a systemic fashion, and to also develop a cadre of well-trained professionals in the field, not only teachers and assistant teachers, but also the food preparation staff. And we also, by the end of the second year, need to have ready, and that's our goal, a sustainability strategy, utilizing creatively the current Head Start budget that we have, and leveraging the community partnerships that we have secured to date. In terms of the lessons learned, one of the issues, and this is based on experience, that we believe is very important, is ensuring that there is unequivocal and consistent support from the administration and the board of directors of the organization at an institutional level. Although the planning starts from the bottom, the buying starts from the top. And any project will be doomed to fail or dead on arrival unless board members and executive staff embrace the project. It is important to have the stakeholders and policy decision makers engage, or at a minimum regularly briefed and updated. There has to be consistency in terms of the tone and the message at an institutional level in order to really get this type of programming off the ground. We're not going to go into specifics. We had our challenges on and we stumbled at the beginning. As I said earlier in the introduction, we are approaching this as apprentices. We're not really experts in the field of farm to school, but it has been very instructive, the entire process. So we speak from experience in terms of those challenges that we faced early on. We have also learned that not one model fits all. Our project has been customized or will be customized to reflect cultural nuances, the needs and beliefs of the targeted population, community-defined priorities, the ones that were identified by the group of stakeholders that were involved in the strategic planning, and also available resources. Our strategy has been to sort of simplify the concept of farm to school, which to many parents, these terms of food desert, food justice, food access can be quite abstract, and make it very familiar to them through showing or utilizing, for example, introducing cultural traditions in the cooking demonstrations, collectively eating, sharing a meal, which is very ritualistic, not only in Caribbean cultures, but in many other cultures. For example, for them to make a connection to their land, to the soils, injecting a sense of, let's say, nostalgia, if you will, bringing them back to when they were children growing up in their country, or learning about special food products and traditional cooking from their grandparents for those that were born here in the mainland. The other aspect that has been very important to us and quite instructive is translating the feedback from the parents into using that to inform the programming, and abstaining from preaching. Our focus is on healthy living and eating well, not really on obesity or losing weight. In terms of the buy-in among stakeholder groups, that is something that we have learned that it can only be achieved through participatory and collaboration. Participatory planning, engaging all stakeholders groups, and participation, and as I mentioned earlier, seeing parents not so much as consumers or clients, but as partners in this process, and also rely on them for information that could help inform your program design and also the strategies that you're going to be utilizing. Now Yoshiko is going to take the last two.
Hi, Imelda. Sorry to interrupt. Yes. We're just at time, so if we could be able to wrap up pretty quickly.
Sure. Pretty much I can let this, I spoke about this earlier about the challenges of staff. In itself, Head Start is very challenging and there are limitations. So part of the challenge that I see is the integration of all these activities among the general population. So I just want to mention something about the procurement of food. There is an availability, and there is a list that is short. So sometimes bringing food from the farm is not very real in terms of fulfilling the whole menu needs for the schools. So I think we need to learn more about this. To really know what is the best way of achieving this. I'm just letting Nilda know that we need to wrap it up because she cannot hear, so we're just sharing the same headset. Okay. So
Yes, I have one point, if I were to just summarize it for the sake of time, a very important point, and that is to recognize, to be sort of humble in recognizing that you don't know everything, and say what you don't know. You have to be self-critical. A reality is that many nonprofits that operate Head Start programs in the inner cities face a lot of limitations and have a lot of lack of expertise insofar as developing these type of programs. So you need to request and welcome training and technical assistance and rely on experts and join this community of learning, if you will, and practice. Bounce ideas and plans, ask the experts to critique it. To us, it has been very helpful, and particularly during this first bumpy year, and the collaboration with partnerships. This is key to really enhancing and expanding programming and bringing much needed expertise to the program.
I think we just wrapped it up, Lacey.
Great. Thank you so much, Yoshiko and Nilda. It is fantastic to hear your example. And for everyone on the line still, if you do have questions and we didn't get to those questions, I'll forward those to the presenters and ask them to follow up. So we will get an answer for you. I really want to thank Yoshiko and Nilda and John for being with us today, as well as the WK Kellogg Foundation for their support of this project and our continued work in farm to early care and education. You will receive a follow-up email with a link to the recording, as well as links to the full case study. So if you have specific questions, I definitely recommend you dig into those case studies. So many thanks to everyone on the line, to our wonderful presenters, and you'll also receive information about our upcoming webinar in April. So we'll look forward to seeing you all again in April. Thank you so much for your time and have a great day.
Thank you.
Thank you.